Hi, I'm Elizabeth and I'm going to be your nurse today. I'm just going to be doing some discharge instructions and going over this packet that you get to go home with, and I'll kind of walk through it step by step so I can explain it better for you, and if you have any questions, feel free to ask them. So, for some safety for your child at home, it's important that if your child were to have another seizure, it's important to protect them from injury. And to do that, you need to ease your child to the floor if they start to have a seizure. And you're going to want to turn them onto their side, which creates the airway to be more open and protects them from any vomit or saliva that could block that airway. You're going to want to loosen your child's clothing to prevent from further injury. You don't want to put anything in their mouth to block them from tongue biting, because that could be more of an injury risk for your child. You're going to want to try to stay calm. If you're calm, your child will most likely be more calm. And you're going to want to comfort your child with soft words and soothing talk. You're also going to want to have you or someone else that's present to time the length of the seizure. And if it lasts longer than 5 minutes, you're going to want to call 911. You're going to want to note the date and the time of that seizure and write down any details precipitating the seizure or anything that you think should be included, what the child was doing beforehand. You're going to want to provide a safe area where your child can rest. You're going to want to check for injuries and stay with your child until they're fully alert. It's also important for you to do some discharge teaching of your own to people who are going to be caregivers or even teachers, family members, other people who could be in the presence of your child during a seizure. So after your child is rested, you're going to want to wait until they're fully awake before you give them anything to eat or drink. The doctor has prescribed your child medication, and we'll review that here in a second. But something that most parents ask is, when should you call for help? So if your child is in need of emergency care, some things to look out for is if your child has another seizure during the same illness. If your child has any new symptoms, this could be weakness or numbing in any part of the body, and you're going to want to call your doctor or seek immediate care after your child is not acting normally after a seizure. And you're going to want to watch closely for changes in your child's health to report back to your doctor. So if any things happen, you can call 911, and you can follow up with your provider at a neurology appointment. And it says here that you do have a follow-up appointment with your neurologist in 1 month, and it has the number here for you to call if you need to reschedule. So the medication that your doctor has put you on is something called levetiracetam, and the dose amount is 400 milligrams, and you're going to take it bi-daily, which is twice a day, and it's PO, which is by mouth. So a little overview of this drug: it's an anticonvulsant, which should help decrease the incidence of your seizures or make them more manageable if you do have a seizure. Some common side effects that you should look out for are agitation, anxiety, anger, depression, dizziness, fatigue, and hypertension. It's crucial that if you have any suicidal thoughts or ideations, that you call your provider and talk to him about it. And you as a mom, if you notice it, then call them as well. So it's important, since you're a pediatric patient, that you use a calibrated measuring device for accurate dosing. And mom, you're probably going to have to do this to make sure that they get the dose that they need. You want to take your missed doses as soon as possible, unless it's almost time for the next dose. You don't want to double dose if you miss a dose. And if for some reason you go out of town, you're on vacation, you forget the medication, you probably want to call your pharmacist and see if they'll fill a prescription for you wherever you're at, because you do not want to discontinue abruptly, because it could lead to increased frequency in seizures. You should probably look at the medication guide prior to starting this medication and read the prescription when you get your refills in case of emergencies. And if there's any chance that you're pregnant or trying to get pregnant, you should contact your provider. And due to this drug causing drowsiness, it's recommended that you don't operate heavy machinery or drive. So if you have any other questions, anything at all, feel free to ask me. If I can't answer it, I'll find someone who can. And I will send this packet home with you so you can refer back to it. And if you have any questions on this packet when you get home, feel free to call the office and we'll have somebody answer them for you.